welcome to the deep dive. We're diving into something pretty interesting today. It's a look at the connection between dry eye disease and mental health.
Yeah.
We've got this fascinating research article straight out of the American Journal of Ophthalmology from a study done at UNC.
Okay.
And it really gets you thinking, like, could your dry eyes actually be a sign of something a bit more going on?
It's a good question, and this study really tried to look into that. They looked at a massive amount of patients.
Yeah, how many?
Over 460,000 at outpatient clinics at UNC.
Wow.
And they were really trying to tease out, is there a correlation between dry eye disease and mental health conditions like anxiety and depression?
Okay, so we're not just talking about, feeling kind of down,
Yeah.
but like actually diagnosed, clinical
Right.
anxiety and depression.
Exactly. Yeah, they wanted to look at the real deal.
So how did they figure that out? Did they, ask the patients, or was it something more objective?
They used hard data.
Oh, okay.
They used what are called ICD-9 codes, which are the codes doctors use to, record a patient's diagnosis.
Oh, okay.
So they could really see, okay, who has dry eye, who has anxiety, who has depression. And they even looked at rheumatoid arthritis
Oh, interesting.
as a comparison group.
Yeah, that makes sense.
Yeah.
Okay, so that takes the guesswork out of it, right? It's not like people just saying, oh, yeah, I feel this way.
Right.
So what did they find? Was there like a link, a connection between dry eyes and these mental health conditions?
There was a link, and it was a statistically significant link between dry eye disease and both anxiety and depression.
Okay, hold on. Statistically significant. What does that mean? Was it a small link or was it a strong link? Help me understand how connected they really seem to be.
It was a strong link.
Oh, wow.
To give you an idea, imagine two groups of 100 people, okay?
Okay.
In the group with dry eye, almost 30 of them would also have anxiety.
Oh, wow.
But in the group without dry eye, only about 10 would have anxiety.
So 3 times more likely.
Yeah, almost 3 times more likely.
If you have dry eye, you're also dealing with anxiety.
Exactly.
Wow. Okay, that's huge.
Yeah, and it wasn't just anxiety. They found the same thing with depression, too.
Really?
People with dry eyes were almost 3 times more likely to also have depression.
So if I'm listening to this and I have dry eyes myself,
Yeah.
it's maybe worth thinking is there something else going on here?
It's definitely a conversation to have with your doctor, right? It doesn't necessarily mean that everyone with dry eye has anxiety or depression.
Right.
But it really highlights a connection there that we can't ignore.
Yeah, for sure. It makes you wonder, though, is there something about having dry eyes that could then lead to some of these, mental health issues, or could it be the other way around?
That's the million-dollar question, isn't it?
Right.
This study was what we call retrospective, meaning they were looking back at data that had already been collected, so they found a strong association, but it doesn't necessarily mean that one causes the other.
Wait, is the chicken or the egg?
Exactly.
We might never know.
Right, but even without knowing the cause and effect, this research is really interesting because it raises some really important points. Think about all the people who go to their eye doctor for dry eye.
Yeah.
This is suggesting that eye care providers might be in a unique position to notice mental health concerns that haven't even been diagnosed yet.
That's interesting. So it's not just about treating the dry eye, but seeing the whole picture.
Exactly. It's about the whole person, not just the symptom,
And what about the other way around?
Yeah.
If somebody is seeing a therapist,
Yeah.
should they be talking about their eyes too? Could treating the mental health issue then improve their dry eye?
It's possible, and that's what's so fascinating about this whole connection. It opens up new avenues for how we think about treatment.
That's really cool.
Yeah.
The researchers also looked at the connection between dry eye and rheumatoid arthritis,
They did.
which we know can also cause dry eye.
Yeah.
So did they find a strong link there too?
It was a little different with rheumatoid arthritis. While there was a connection, it seemed to be much stronger in younger adults, particularly those between 18 and 35.
Oh, that's interesting.
Yeah.
Why do you think that is?
That is a great question, and unfortunately, this study doesn't give us those answers.
Okay.
There's still a lot we don't know.
So it sounds like we have a lot to learn about this whole dry eye connection.
We do.
It's complicated,
Yeah.
but let's not gloss over the details.
Yeah.
Let's get into the specifics of this study. How did they do it?
Yay.
And how did they come to these conclusions? We'll dive into all that right after this.
It's one thing to say there's a connection,
Yeah.
but it's important to really understand how they got there. how the researchers came to that conclusion.
You're right. We got to make sure their findings are solid.
Yeah.
Like we know women are more prone to dry eye than men.
Right.
And mental health stuff that can vary across different age groups too.
Absolutely.
So how did they account for all these differences?
Well, they did something pretty cool statistically called logistic regression to control for things like age and gender. It's basically a way to mathematically level the playing field.
Right.
So we can really isolate that relationship between dry eye and mental health.
So they weren't just looking at like raw numbers.
Right.
They were really able to zero in on the specific connections.
Exactly.
Even with all the other variables.
Yeah, they even got more granular and divided the participants into 4 age groups.
Oh, okay.
18 to 35, 36 to 50, 51 to 65, and then over 65.
Gotcha. So they could see if the link was consistent or different.
Across different stages of life.
Exactly. So did they find any differences? Like as people got older, was there any change in that connection?
For the most part, the link between dry eye and both anxiety and depression, it stayed pretty consistent across all the age groups.
Interesting.
But remember that rheumatoid arthritis connection?
Yeah.
That one, that seemed to be stronger in the younger folks.
Yeah.
That one did vary across age.
No.
With the strongest link being in that 18 to 35 group.
So age matters more for rheumatoid arthritis, but not so much for mental health.
It seems that way, yeah.
Okay, so it sounds like dry eye really can affect anyone at any age, and we shouldn't just brush it off.
Exactly.
We need to pay attention to that mental health piece, too.
Absolutely. We need to look at the whole person, their individual circumstances, and all the factors that might be contributing.
Right, it's not one size fits all.
Right.
Now, this study doesn't prove that dry eye causes these conditions, or vice versa, right?
You're right. It doesn't prove cause and effect.
Okay, so what are some other things that could be going on?
Well, one theory is that they share a common underlying cause.
Okay.
Like, for example, there's a lot of research now showing that inflammation
Interesting.
plays a role in both dry eye and mental health conditions.
So it's not that one's causing the other, but they're both kind of symptoms of something else?
Exactly. Like 2 warning lights flashing on your car's dashboard.
I like that.
They both need attention,
Yeah.
but it might be the same root cause.
Okay. What else?
Another possibility is lifestyle factors. Things like high stress levels. We know that stress can make dry eye worse.
Oh, yeah, for sure.
But it can also increase the risk of mental health issues.
Oh, so it's like this vicious cycle.
Yeah.
The stress makes the dry eye worse, and the dry eye makes you more stressed.
It can definitely feel that way. And we can't forget about medications, too. Some antidepressants are known to cause dry eye.
As a side effect.
Yeah.
Oh, wow.
So it might not be the mental health condition itself,
But the meds,
but the treatment.
that's complicated.
It is. It's a complex web. But that's why we need more research to really untangle these relationships and understand how dry eye and mental health interact.
Okay. But we're not researchers.
Right.
So what can we do with this information? What's the takeaway for our listeners?
Well, if you're dealing with dry eye,
Yeah.
it's worth thinking about your mental well-being. Are you feeling stressed? Anxious?
Okay.
Talk to your doctor about your symptoms and any mental health concerns you might have. You are your best advocate. And if you're already getting treatment for anxiety or depression, bring up any dry eye issues with your provider.
So just keep those lines of communication open.
Exactly. And, this study focused on anxiety and depression.
Yeah.
But it makes you wonder, could there be a connection to other mental health conditions too?
That's a good point. It's like we're just scratching the surface here.
Yeah.
This research is really opening up a whole new way of thinking about the connection between our physical and mental health.
It really is.
I'm really seeing dry eye differently now after all this. It's pretty fascinating.
It really is, yeah. It makes you think about how connected everything is in the body. And it opens up some exciting possibilities for treatment in the future. Maybe someday we won't just be treating the physical dry eye, but we'll be addressing the mental health side of it, too, in a more holistic way.
That would be amazing. Like what if things like stress reduction techniques, mindfulness, or even therapy could actually help with dry eye symptoms?
It's certainly worth exploring. We know stress can make dry eye worse. So if there's a mental health component, finding healthy ways to manage that stress could really make a difference.
And the other way around, too.
Yeah.
Right? If you're already seeing a therapist for anxiety or depression, maybe talking about any dry eye symptoms you have could be helpful. Maybe treating the mental health issue could help the dry eye, too.
Exactly. It's all about recognizing that connection between our physical and mental health. Treating one can often have a positive impact on the other. It's like a ripple effect.
Yeah, it's all connected. But let's be real, not everyone can afford therapy or easily access mental health care.
That's true. There are definitely barriers, but even so, there are things people can do on their own. There are lots of free resources, online apps for meditation and support groups that can help people connect and feel less alone.
Those are great options. And sometimes just making simple lifestyle changes can make a difference too, like getting enough sleep, eating healthy, exercising, and spending time in nature. All that good stuff can impact both our physical and mental health.
Absolutely. Taking care of ourselves proactively, even in small ways, can really add up over time.
This whole conversation has really been an eye-opener for me, no pun intended.
Right.
But it makes you think, the next time your eyes are feeling dry, maybe you don't just reach for the eye drops. Take a second to check in with yourself and think about what else might be going on.
Yeah, listen to your body. It might be a sign that you need to pay a little more attention to your mental health, too.
Well said. So that wraps up our deep dive into the fascinating connection between dry eye disease and mental health.
We covered a lot today,
We're
from
told-
the research itself to what it means for treatment and where we go from here. Hopefully you learned something new.
I know I did. Remember, knowledge is power. And by understanding how our bodies and minds are connected, we can make better choices for our health and well-being. Thanks for joining us on the Deep Dive. We'll see you next time for another exciting journey into the world of science.